The following segment is sponsored by Granger Medical Clinic. Well, if you or a loved one have an open wound on your leg or foot that hasn't healed, Dr. Greg Anderson from Granger Medical Clinic can help. Dr. Anderson, welcome to the show. So great to see you.
Thank you. Thanks for having me.
Absolutely. I feel like this is a really important topic that we're going to discuss here today, and it applies to a lot of people. But what kind of procedures can you do at your practice to help open wounds heal?
Well, I've always done all kinds of reconstructive foot and ankle surgery, but the wound care is the most rewarding.
Yeah.
Because I've had patients that have had wounds for months and even longer that haven't healed. And we have a really good team to help these wounds heal much faster.
Absolutely. I mean, having a good group of people, we were just chatting a couple minutes ago, I really feel like that's everything.
Yeah.
And why is it so important to have a professional take care of these type of wounds?
Well, because, you know, we are able to, especially if you have Medicare, you qualify for a special program for wound grafting. And this wound grafting, where we use these amnion grafts, really accelerates the wound healing. I have a interventional radiologist that can get more blood flow down to the area of the wound. So we have to assess, is there enough blood getting to the wound to heal? Because if there's not, it's going to be really slow.
Right.
Healing, yeah.
It can get really serious, so it's important to have those different specialized people as a team. And speaking of which, you've established this great team, so let's hear about it.
Well, I work with interventional radiologist Aaron Frodson. He's the best I've ever run into, and he can get blood down to the furthest parts of the foot.
Wow. Where
others just said we can't have any success, and so that's been really rewarding. He also treats the venous insufficiency that often causes bad wounds.
Wow, okay, incredible. Well, let's talk a little bit about your background, Dr. Anderson. You have so much experience, you're really an established doctor specifically in this field. So tell us a little bit about yourself.
Well, I have just kicked a lot of tires, let's say, and I have rubbed shoulders with some of the best wound care specialists in the Valley. I also did a program by Rob and Andrea Ferguson called Amanaki Fo'o, where we went to Tonga and did wound care and limb salvage twice a year for about 7 years.
What an incredible experience.
That was really awesome.
Oh my gosh. Yep. Well, thank you for giving back. I mean, that's so great and life-changing.
Yes.
And if someone has Medicare, they actually qualify for this special program. You kind of touched on that, but tell us more about that.
You know, in 2007, they did a study, and $116 billion were spent on diabetic medical problems. A third of that was just wounds, diabetic wound care.
Wow, that's just astronomical.
That's why Medicare loves this program, because it keeps these patients out of the hospital.
Sure, so important.
And prevents them from losing a limb.
Right, so important.
So limb salvage is key.
Absolutely. Where can we go for more information, Dr. Anderson?
You can call our office at 801-576-2015.
Incredible.
That's right. I never call it. 576-2015. And Tina will set you up an appointment and get you in the same day, unless I'm in surgery.
I love it. Well, we so appreciate you being on here and
thank
changing
you.
lives. Thank you.
Thank you so much.